I'm Dr. Volkan Turunç. I'm a general surgeon. I'm working in a transplant team in Göztepe Medical Park Hospital. We are performing over 100 kidney transplantations per year. And most of them are unfortunately from living donors. There are two types of donors, the cadaveric donors and living donors. In Turkey, the cadaveric donation is very low, so that's why we are performing most of the transplantations, nearly 85% of the whole kidney transplantations from living donors. In our country, over 3,000 kidney transplantations per year are done, and over 2,500 of them are from living donors. To be a donor, there are some legal issues. You must be a relative of the recipient. For example, we can accept mother, father, sisters, brothers, nephews, aunts, uncles as donors. But if you aren't a relative to the recipient, we cannot accept you as a donor. And for being a living donor, you must have no health issues. You must be completely healthy. Yes. And for cadaveric donation, unfortunately, it's very low in Turkey, and it's a problem in all around the world. But in developed countries, the rate is 50-50. 50% cadaveric, 50% living donor transplantation. But as I said, in Turkey, the cadaveric donation is very low, so we are performing approximately 400 cadaveric transplantations, cadaveric kidney transplantations per year. And there are many patients waiting on the lists. Over 20,000 patients are on the waiting list, and day by day the number is increasing. So that's why we must increase cadaveric donation. Here in our hospital, as I said, we are performing over 100 kidney transplantations per year, and we are a very experienced team, especially in pediatric transplantation. We can accept all pediatric patients over 10 kilograms for transplantation if they have suitable donors, if in case there is a cadaveric donation. And there's another option for transplantation called exchange paired kidney donation. For example, you are a patient and come to us for transplantation, and you have a donor, a relative, your relative wants to be a donor, but your blood types do not match. And there's another pair, a recipient and donor, and they have the same situation. The donor is the relative of the recipient, but the blood types do not match. But if the other pair's donor match you and your donor match the other recipient, we can change places of the donors. And in that case, we can perform 2 transplantations at the same time. And this number can increase 3, 4, 5. We are the first team in Turkey performing 4 exchange kidney transplantations simultaneously. We have many international patients from all around the world. Bosnia-Herzegovina, Serbia, Kyrgyzstan, Kazakhstan, Iraq, Lebanon, Syria, United States, Netherlands. We have many international patients. In our country, we have huge experience on transplantations, especially on liver and kidney transplantation, and also bone marrow transplantation. So that's why we have many international patients here, and our success rates are very high. They can be compared with developed countries, for example, US. The 1 year survival rate for kidney transplant recipients is 99%, and 1 year graft survival, 1 year kidney survival is over 97–98%. These rates are excellent. They can be compared with US rates.
Yeah. After surgery, how many days people must stay in hospital?
Generally, if there's no complication, if no complication related to surgery, of no complication of rejection of the organ, 1 week is enough for the recipient, and 2 or 3 days is enough for the donor. We cannot accept friends directly as donors, but there are special commissions of the Turkish Ministry of Health in every city. For example, in Istanbul, if a recipient comes to us with a friend to be his donor, we prepare them, we make the medical evaluation first of all, and then send the medical evaluation and some documents to this commission. It is called ethical committee. The ethical committee consists of a lawyer, someone from police department, and psychiatrists. Both recipient and donor goes there with their documents, and if the ethical committee lets us, gives us permission to do that transplantation, yes, in that case we can do. That's because they want to prevent a money relation between donor and recipient. If we realize that, we immediately stop the evaluation period. It's strictly forbidden in Turkey. We cannot go on the medical evaluation, and we cannot perform transplantation in these kinds of situations. We have to inform police in these situations. It's strictly forbidden in Turkey, as in most of the countries. 1 year graft survival is over 97–98%, and 1 year patient survival is over 99%. So, as I said, the rates are very high. Of course, we cannot talk about 100% success. It's impossible, especially in surgery, especially in a field like that, like transplantation, because you are placing a foreign body in someone's organ. It's not the recipient's own organ. It's coming from someone else. So there is an issue in transplantation called rejection. That rejection is the response of your body to the new organ. So in nearly 5 to 10% of the all transplant patients, we see these acute rejections. But we have some treatment strategies to heal that situation. And in most of the patients, if we see these acute rejection problems, we can heal most of the patients with these treatment strategies. But of course, unfortunately, there is a risk of kidney loss, but it's below 1% kidney loss. And also, if you are married, your husband's relatives can be donors to you. Not only your relatives, but your husband's relatives can be a donor to you.